Hi, I'm Dr. David Magnano. I'm a licensed chiropractor in the state of Florida, and I'm here to talk to you about digestive trouble today. Many people have heard that chiropractic can help with digestive problems. This could be any digestive problem. It could be gas and bloating, it could be heartburn, it can be ulcers, constipation, diarrhea. Anytime there's a symptom in the body, regardless of what the symptom is, it's a sign that something's not working as it should. Something is breaking down, and because the organ, tissue, or area is breaking down and it's not working and recovering from the day's stress, as it continues to break down, soon you'll get a symptom. Now, it doesn't happen right overnight. Generally, the organ will start to break down, and as it starts to go downhill, you'll have more and more trouble. So I want to explain how we actually help with that. We handle the nervous system. The nervous system basically is the brain and the spinal cord that comes down and then peels off nerve roots that travel to every single organ, cell, and tissue in the body. There's also nerves that travel to the muscles and joints and can create stuff like joint pain or muscle stiffness. But specifically talking about digestive problems, what happens is the brain is in constant communication with the stomach, with the intestines, with the pancreas, all these organs that are tied into normal digestion. As soon as one of those areas breaks down, you'll start to develop a symptom, and then in many cases, somebody will take something, like they'll have heartburn, or they'll have some stomach upset, indigestion, gas or bloating, something like that. They'll start to take some antacids or over-the-counter Prilosec, things of this nature. Now, even though that helps with the symptom, it doesn't actually do anything to correct the cause of the problem. And there are some risks associated with that. There's a natural defense mechanism that works within the stomach. There's a natural pH, which is the amount of acid that the stomach has. When you take an antacid or one of these other medications, what happens is it changes the natural makeup of that. That allows things to grow and damage the tissues more so than just the symptom or the problem that's going on. So what we do is we actually check the nervous system. The best way to check the nervous system, the largest nerve roots in the body actually come off the spine. You can see here there's a spinal column. This is a model of a spine. Each segment has an individual ability to move. Each segment is separated by a disc. And then the most important part is you'll see a nerve root here. Now this nerve root is cut off. But you can see on this chart, the nerves actually travel to all the organs and tissues, blood vessels, glands, things of that nature. What happens is somebody can have a condition called a subluxation. That's a fancy word that means the bone is shifted out of place enough to pinch or irritate or alter the nerve flow that comes out off the spinal cord at the nerve root. So a spinal bone can get shifted out of position. We call that a subluxation. We can actually test the nerves to see if they're working correctly. We can actually even head off somebody that's having a problem. If somebody has a problem, let's say there's some pressure on the nerve traveling to the stomach area, as you see on this chart. Even if they don't have symptoms today, but we know that area is breaking down, they're going to lead to symptoms. So the most important aspect in keeping your body functioning normally, including all the digestive organs and systems, is to make sure that the nervous system can control and coordinate every function in the body, as it's designed to do. So, the intestines are a muscular tube. If we put pressure on the nerve root going to the intestines, they're not going to work normally. As the intestines don't work normally, it's going to lead to some symptom, which is just a red flag that says something's not working correctly, the body's not able to recover or work as it should, and that area or organ will start to go downhill. As that happens, as the organ continues to break down, you'll actually develop a symptom. So the first thing we do with anybody that comes in with digestive problems is we run a specialized nerve test. It's a specialized test that we run up the spine, and it actually tells us how well the nerve roots that come off the spine, how well they're working. And we know if we have some nerves that are shut down going to the digestive area or organs, that area is going to start to break down and ultimately have some symptoms. Now, if you're just taking a medication to cover up the symptom, it's great that you feel better with the medication, but in many cases, the organ is still breaking down, and in many cases the medication is changing the natural makeup of the organ or tissue, leading to some more problem afterwards. So what we do, we run a nerve test on anybody that comes into the office. We want to check and see how the nerves are working. Afterwards, then we can make some recommendations as to how to handle it. We do this nerve test for anybody that wants to call our office. We do it as a community service, as an educational tool to educate people. Many people don't know that it could be as simple as fixing their nervous system and then allowing the organs and the tissues to heal and to recover as they should. So once again, my name is Dr. David Magnano. I'm a licensed chiropractor in Clearwater, Florida. I practice right on Gulf to Bay. If you want to call our office and let them know that you've seen this video, we'll be glad to schedule that nerve test for you. The test itself takes about 10 or 12 minutes, and the visit from start to finish should take no more than 30 minutes. Nice talking with you.